Can the elderly undergo plastic surgery? This video has the answer.
Talk with Dr. B, plastic surgeon.
Hello, I'm Dr. Chapong Satrasatit, a member of the Society of Plastic Surgeons of Thailand. Today, I'm here to talk with friends and everyone about a common question. As an elderly person, can we undergo plastic surgery just like anyone else or those younger than us? The answer is yes, you can. There are no specific restrictions. If you're asking for a number to define elderly today, that's not really how it works. Age is truly just a number. That's the real answer, because people's lifespans are increasing due to modern health and well-being, with so many facilities and healthcare options available. Before someone feels truly old, I think nowadays it might even be over 70 years old. Yes, provided there are no other health issues. So we don't look at the numbers, we look at the state of well-being at the time of surgery to see if everything inside is functioning normally. If it's a major surgery requiring general anesthesia, it's about whether your health allows for anesthesia without life-threatening risks. For example, having untreated coronary artery disease, or having a dangerously irregular heartbeat, or having abnormal thyroid hormones that are not well controlled or stable yet, can all be serious concerns. Or if you have severe asthma with frequent attacks or symptoms that are not under control, that is also important to consider. Additionally, if you have abnormal bleeding conditions that require you to take blood thinners, these are all situations where extra caution is needed. Please make sure to discuss any of these conditions with your healthcare provider before proceeding. That cannot be stopped, as it would affect existing conditions. For instance, if you have ischemic stroke, have experienced weakness on one side, or have facial drooping or deformity from muscle weakness, and your doctor still requires you to take medication continuously, then you shouldn't do it. Or if you have an irregular heartbeat that risks blood clots, where the doctor might still need to give you blood thinners continuously. For other conditions, you must get clearance from your primary physician first to ensure that stopping those medications can be done safely without harming the patient. So the principle is that the elderly can undergo plastic surgery. It depends on their health at the time and the type of surgery being performed. We have to consider two factors: whether it's just local anesthesia or general anesthesia. If it's just local anesthesia, it might be easier. However, regardless of the plastic surgery procedure, things like blood thinners or vitamins such as fish oil, omega-3, Q10, vitamin E, ginseng, ginkgo, or similar supplements may need to be stopped at least 10 days before surgery, and also after surgery for about 7 to 10 days. Therefore, stopping anything that stops blood thinning or blood clotting must be stopped for at least 2 to 3 weeks, safely for the body. Therefore, health checks before surgery might be more extensive for the elderly than usual, slightly more than for a typical person. For example, surgery for the elderly is often about, it could be eye surgery mostly, upper or lower eyelids, or a facelift, neck lift, or fat injections, forehead lifts, breast lifts, tummy tucks, or liposuction for some individuals. Also, don't forget to provide your full personal history, such as underlying diseases, medications, and any supplements you're taking. Detail any ongoing treatments with your doctor. Some may have tumors, be on chemotherapy, or long-term hormone therapy. You must not hide this. Don't try to hide it just to get the surgery you want, as it won't be safe for you. That's highly discouraged. And after surgery, how well can that elderly person care for themselves? Will someone need to help or stay with them? This includes follow-up care at home, like wound care, especially when the surgery affects mobility, making it more difficult. For instance, surgery on the torso, whether it's the chest, abdomen, legs, or buttocks. If it's facial surgery, it might not affect your ability to move around, sit up, or walk very much. So don't forget to prepare for this part, including wound care, while there's still swelling and bruising, even after you've returned home from the hospital. So the answer is there's no age limit, but there are health conditions where cosmetic surgery shouldn't be done because it's not essential for life or health. Since this isn't a medical treatment, you must keep this in mind. Okay, so this is the answer that people might already know, but the doctor is just emphasizing it for certainty. So if there are any further points you'd like to ask the doctor about plastic surgery, please comment and ask. I'll find tips and tricks or various topics to discuss with you all next time. If you find the doctor's clips useful, please like, share, and subscribe. Goodbye.
Talk with Dr. B, Plastic Surgery.